Hello everyone. In this video we are going to talk about the second part of the video of the broad classification of the routes of drug administration. If you haven't watched the first part of the video, before proceeding ahead with this video, do watch the first part. Here in this video we are going to talk about the systemic routes. What are systemic routes? The drugs that are administered into the systemic circulation or that produce systemic effects while via entering through the blood are called as systemic routes. We have here enteral routes as first subclassification, in which we have oral, sublingual and rectal routes. Three types: oral, sublingual and rectal routes. Now oral route, first one, this is a very common and acceptable route. Yeah, everyone prefers now these days as oral route. What do they include? They have your dosage forms as your tablets, capsules, syrups, mixture. Okay, for example, whenever you have fever, you take a paracetamol tablet, you take omeprazole for your peptic ulcer. These are the tablets which are given orally with water or other vehicle. Advantages are it is safer, cheaper, it is painless, convenient for repeated and prolonged use, and can be self-administered. You have certain disadvantages also, like it cannot be administered at the case of emergency case or to uncooperative patient, or the patient which is you know um unreliable patient, unconscious patient you have, then it is very unpalatable and highly retent drugs. These are also unabsorbable drugs. Example, you have aminoglycosides. This destroyed by the digestive juices. Example, insulin. They have extensive first pass metabolism. Example, your lignocaine, etc. And side effects also, such as vomiting and diarrhea. Second is the sublingual. Now you have seen there are some medicines which are kept under your tongue. Example, your nitroglycine is given for the acute anginal attack patients, or your buprenorphine is given for prevention of myocardial infarction. Why? Because they have quick onset of action. They can be terminated. Yeah, you can spit out of your tongue. Then it first important thing, it bypasses first pass metabolism. The self administration is possible. Then disadvantages, it is highly irritant and very lipid soluble drug, and they have a bad odor and taste. Coming to the third subclassification, rectal route. As we have talked in the topical, you have again enema and suppositories. Okay, in suppositories you have suppositories are in the solid forms for local topical effect as well as systemic effect. Example, you have indomethacin for rheumatoid arthritis. Then you have enema. You have two types of enema, evacuant and retention, which is now from which the retention enema is used for systemic. Example, diazepam for status epilepticus in children. Moving ahead with a very important topic, that is parenteral routes. Parenteral routes are nothing but the drug which are not given through enteral routes. It is given directly into the systemic circulation. It is directly made enter into the blood within few minutes or seconds. Okay. The advantages are it can be given in the case of emergency. It doesn't matter whether the person is unconscious or conscious. If the person is uncooperative or unreliable, it can be useful. Then the patient with excessive vomiting and diarrhea. Yeah. Then you have it is suitable for irritant drugs with first pass metabolism. The drugs that are not orally absorbed or that destroyed the digestive juice. These are the major disadvantages of the oral dose. So hence that is enteral. Yes, so enteral, if it is not possible enteral, how it is given? Parenteral. Okay, it also has disadvantages that only one syringe is to be used, right? That is, aseptic condition should be maintained. Sterile and expensive hota hai this techniques. Then you have various invasive techniques that are also painful, and it is, cannot be usually self-administered. This is a major disadvantage of parenteral doses. You need someone to assist you. Okay, then you have local causes, local injury to nerves or vessels. If the parenteral dose is not given correctly, it can harm yourself. Then you have inhalation. Volatile liquids and gases are given for inhalation for systemic effects. General anesthetic, again, nasal sprays हो गया. What are the advantages? Quick onset of action is required, dose required is very less, so systemic toxicity can be minimized. Your amount of drug administered can be regulated. Local irritation may cause respiratory secretion, then bronchospasm is a major disadvantage. Okay, there can be excessive respiratory secretions हो सकता है, और जैसे छोटे छोटे अस्थमा टाइप ऐसे मतलब डिसऑर्डर्स डिसएडवांटेजेस हो सकते हैं. We have injections. Now injections can be given through intradermal route, subcutaneous route, intravenous, that is your IV, intramuscular, transdermal, etc. Okay, intradermal route क्या होता है? This is the drug or the injection is, injected into the layers of skin. Example, तुम लोगों ने बचपन में BCG की वैक्सीन, that is Bacillus calmette urine की vaccination लिए रहेंगे. So that is a small amount of drug that is administered. Now first let's understand what is your, layers of skin. I hope you have studied skin का structure in SEM 2. First you have the epidermis. Below the epidermis there is dermis layer, then you have subcutaneous fatty tissue, and then you have muscle with vein. So intradermal tissue is given at the epidermis in the layers of skin. Okay, example is your BCG. Then you have subcutaneous, the patient suffering from diabetes gives generally said administered injections such as your insulin. Then you have adrenaline. Okay, these are in the subcutaneous. Can you all say this is the subcutaneous fatty tissue? Okay, so your adrenaline and insulin are the examples which are given in thigh, abdomen, and arm. Next, it is self-administration is possible, as I said, and depot preparations like your Norplant contraceptions जो होते हैं, these are also inserted in your subcutaneous tissue. It is suitable only for non-irritant drugs, and okay, if it is creating irritant, so it is very dangerous for the person who is self-injecting it. Okay, drug absorption is slow, and hence it is not very suitable for emergency cases. Then intramuscular route, intramuscular is, see this muscle with vein. You can see the intramuscular injection is inserted into the muscle, that is the last portion of the skin layer. Okay, drugs such as into large muscles such as your deltoid, your gluteus maximus, and your vatus lateralis are injected. You are having examples as your paracetamol, diclofenac. Okay, but a 5 to 10 ml is only given at that time. Absorption is more rapid than the oral route. Obviously, mild irritants, depot injection, soluble substances, and suspensions can be given by this. Also, it is now parenteral. So first thing that everywhere a disadvantage is there, it should be aseptic conditions, self-administration not possible, and it may cause injury. And you have one more point that they are painful and may cause abscess. Okay, intravenous IV route जो दिया जाता है, whenever the energy of the person is down, it is given into bloodstream through the vein. Okay, you can see, I'll show you the image here. This is the vein. Yes, and intravenous tissue is, injection is given into that vein of the muscles, right? Here we are having three types again: bolus, slow intravenous injection, intravenous fusion. This can be administered like this. Now bolus mein you have single and relatively a very large dose is injected. Example, you have ranitidine for air bleeding of peptic ulcer. Slow intravenous injection क्या होता है? Morphine and myocardial infarction. Okay, then you have intravenous infusion, for example dopamine infusion in your cardiogenic shock, or mannitol infusion in your cerebral edema, or fluids are infused intravenously for dehydration. These are majorly done in our daily, whenever person का बीपी वगैरह लो हो जाता है तो ये फ्लूइड्स दिए जाते हैं फॉर डिहाइड्रेशन. बायोअवेलेबिलिटी 100% होती है उसकी, क्विक ऑनसेट होता है, लार्ज वॉल्यूम एक साथ दे सकते हैं, डिहाइड्रेशन के लिए फ्लूइड्स देते हैं, हाईली रेटेंट ड्रग्स है, एंटी कैंसर ड्रग्स जो होते हैं ये दिए जाते हैं क्योंकि ये डाइल्यूट हो जाते हैं ब्लड में. हाइपरटोनिक सोल्यूशन ऐसे ही दिए जाते हैं, जैसे वी हैड टेकन एग्जांपल ऑफ 20% मैनिटॉल. ओके, प्लाज्मा लेवल बढ़ाने के लिए, दैट इज योर dopamine infusion which we have taken here then in examples. Once the drug is injected, it cannot be halted. Local irritation may cause phlebitis. Self-medication again not possible. Strict aseptic होता है. Depot preparations cannot be given intravenous. Please note this point as very important. And then you can have injuries such as your necrosis, tissue or cell necrosis, that is death of cell, and also sloughing of tissues. Drugs should be usually injected slowly. Before injection, make sure the tip of the needle is in the vein. Then you have certain intrathecal routes, that is your antibiotics and amphotericin are given. Then your lidocaine, these are the spinal anesthetics, okay, which is given in your subarachnoid space. Okay, then you have intra-articular route, that is it is injected directly into the joint space. And this is given in the case of rheumatoid arthritis. And strict aseptic conditions are required, and अगर बहुत ज़्यादा ये दे रहे तो it can cause a major damage to your articular cartilage. Then you have your transdermal route, wherein it is in the patch, like this is very new now. पैच या ऑइंटमेंट के फॉर्म में द ड्रग इज डिलीवर्ड इनटू द सर्कुलेशन ऑफ सिस्टमिक इफेक्ट. You have scopolamine patch for ciliary, motion sickness, nitroglycerin patch ointment for angina, osteogenic patch for hormone replacement therapy. It is somewhat this way, wherein there are drug reservoirs, rate controlling membrane, then adhesive layer, that is your मतलब फेविकॉल के जैसा होगा तो वो स्किन को चिपक जाएगा. देन यू हैव आउटर लेयर टू पील ऑफ फ्रॉम द स्किन. फिर ये बैक लेयर हो गया. यहाँ पर ड्रग्स होते हैं रखे हुए विच इज रिलीज इन टू द ब्लड. ओके, यू हैव सीन इन सम पेशेंट दैट दे आर sticking on your hand. I'll just show you the image. Okay, you can see they are placing over here or somewhere here, or sometimes here also they are placing. Okay, this is the transdermal patch wherein the drug is restored in that membranes. Okay, which can be controlled. Self administration is possible. You can stick by your own. Patient compliance is better. Systemic side effects reduce. Drug of action is very prolonged in this. Okay, and plasma concentration is constant. Disadvantages ऐसे है कि बहुत ज़्यादा expensive है. Your patch may fall and it is unnoticed. Local irritation से you have dermatitis, itching, redness or ऐसे problems are seen due to that adhesive layer. Okay, I hope the video is very clear to each and every one of you. Please do rewatch 2 or 3 times for more better understanding, and make a note or make short notes of it. And if any doubt, do comment in the comment section. Thank you everyone. You can again refer to the third summary for more extra reference of the theory. Thank you. Please subscribe my channel.